Good evening. Good evening. Well, so happy to that you can join us this evening at the Bethel Missionary Baptist Church. My name is Alvin Stafford. I am the senior pastor, and I'm so excited as people start to kind of trickle in. Just want you to say hello to our esteemed guests, and so appreciative that you could join us today. I have the honor of kind of sitting and asking questions and having dialogue back and forth with two very professional people that we call friends and people that we trust. First, I would like to first introduce Lauren Espy of the MLK Hospital, Martin Luther King Hospital, Community Hospital, right here in the city of Watts, in Los Angeles. Lauren, thank you first for coming today, and then most of all, thank you for the partnership and the relationship and the resources that you brought to Bethel, and then more importantly, thank you for Dr. K, that you've made a resource for us today. So, if
Yeah,
you would, if you would introduce us to Dr.
sure.
K, and then we'll get started.
Absolutely. Thank you so much, Pastor Safford, for having us today. Everyone, I'm Lauren Espy. I'm the manager of community programs from MLK Community Healthcare, and I have the honor of introducing Dr. Maita Kuvhenguwha, and she's our infectious disease doctor, and she's been on the front lines of the fight against COVID-19 ever since it began. And she also she graduated from University of California, Irvine, and she received her medical degree from David Geffen School of Medicine at UCLA in partnership with Charles R. Drew University and UCLA Medical Education Program. And she's a second generation doctor from a family with a long history of serving South LA. So, Dr. K, she's an expert on the prevention and treatment of COVID-19, and she's here to answer your questions. So, Dr. K, everyone.
Hi.
Thank you. I'm sure everybody's doing this. Um, Round of applause. Thank you, Dr. K, again for coming today. And it was just it's good to see a black sister, and I'm sure there are not many of you walking around, infectious disease specialist. Can you tell us a little bit about what that means and what your journey was like becoming a doctor?
Sure. So, like Lauren said, I'm a second generation doctor. So, my dad was actually a surgeon at the old MLK. So, when
Wow.
I was a kid, I would go there on the weekend with him. I'd sit at the nurse's station while he went around and rounded on patients. And, that's how I figured out that I wanted to go into medicine, was seeing him care for patients and then be so grateful for the care that he was providing. Another reason why I wanted to go into medicine was that my mom is actually born and raised in Los Angeles from South LA, Watts, and our family's been plagued by a lot of health issues. So I figured, I need to get trained so that I can help my family stay healthy. Um, as Lauren mentioned, I'm an infectious diseases specialist, and so what this means is that besides COVID-19, I treat a wide variety of illnesses, anything you might think of: pneumonia, a lung infection, meningitis, brain infections, skin and soft tissue infections, HIV. So I have a lot of different patients. I work at the hospital and the clinic, and my favorite part of my job really is seeing the difference that I can make in my patients' lives, allowing them to have high quality care close to home. They don't have to drive to Westwood. I give them my 100%.
Wow. Um, wow. That's my first time knowing that you were a second generation doctor. As I told Lauren this story when we first met, that when they closed the original Martin Luther King Hospital, I was at my church, and we marched from my church to the hospital in solidarity to show that the community needed a hospital.
Mm-hmm.
So it's good to know that your history ties back into all the way back into those original days, and to see it now be back
Mm-hmm.
and be really high end hospital. I've walked the corridors, and I've seen
Mm-hmm.
the digital displays, and I've seen the automation, and I've seen that how good of a product is being kind of displayed there, and I'm really appreciative for it. I got a little rapid fire question for you guys before we get into talking about COVID. Dogs or cats?
Dogs.
Dogs,
Dogs.
yeah.
Okay. Pizza or hamburgers?
Pizza,
Pizza. Yeah. Yeah.
Football, baseball, or basketball?
basketball,
Basketball. Definitely basketball.
Basketball. Okay.
Mm-hmm.
Um, Clippers or Lakers?
Lakers.
Lakers.
Colors.
I did not
Yes.
set that up. I did not set that up. That was that happened organically. And then last one is in one word. Tell me what you're grateful for.
I would say my family, just that everybody stayed healthy throughout the pandemic, and they're here to support me, and I'm there to support them.
Mm. I would say health.
Yes, I second both of those emotions. To not to date myself, but I second those emotions: health and family. Um, so I fielded a bunch of questions from a bunch of different sources, and one of the just kind of get us kicked off into this conversation about COVID-19 and about the vaccinations, and why should I be vaccinated? One of the first questions that we asked is, what was the difference between COVID-19 and other viruses? Can you give us some kind of differences that stand out?
Sure. So the most obvious ones are that this virus, COVID-19, spreads more easily. It's more contagious, way more contagious than influenza or regular coronaviruses that cause the common cold. Another tricky thing about COVID-19 is that it can take longer for people to show symptoms. So with
Okay.
flu, we're talking about like 1 to 4 days to show symptoms, but with COVID, it could be anywhere from 5 to 14 days. So people could be walking around sick, able to give this virus to people and not know. There's also, it appears to be much more asymptomatic transmission. So people will feel okay, but they really are infected with COVID and they're capable of spreading it to people. And finally, this virus seems to cause more severe illness than the flu. We have had more people in the hospital, more people dying from COVID-19 than the flu. There's also one thing I should bring up. Some of the symptoms are a little bit different compared to the flu. So both of them can cause things like fevers, chills, sweats, body aches, headaches, uh, diarrhea. But COVID-19 is really the only one that's going to cause you to lose your sense of taste or smell. And then in terms of complications, COVID-19 has a lot more complications. We may get to a question later about long haul COVID. I don't know if you have that in here, but some people are still having brain fog 6 months after getting
Yeah.
COVID-19, or they still feel short of breath, even though their oxygen saturation is back to normal. So we know that COVID causes inflammation in the body and it has lasting effects, and also some unusual side effects like strokes and blood clots that the flu doesn't cause.
Yeah, I when this first started in COVID, and I heard that it was kind of affecting people's taste and smell. I felt that was like super strange, right? I don't recall another virus that extracts or affects that your ability to taste and smell. Are there any other viruses out there that does that?
Not that I'm aware of.
Yeah.
Another thing that's interesting about it is that the taste and smell don't always come back right away. I've had
Right.
patients tell me that 3 months down the line, they still can't taste their food properly.
Yeah. Okay. COVID is different. It attacks your
Hmm.
taste and smell too. Okay. The people of color. I know we're specifically talking to our congregation and to our community, and we're disproportionately taking the vaccination at a lower rate. I should say we're taking it at a lower rate. Can you tell me how it affects us? If it affects us differently, if it's more aggressive on people of color? And if so, do you know why?
It's a really good question. The answer is yes. It does affect us more aggressively. So people of color, African American, Hispanic, Native American, have a higher incidence of the medical problems that put people at risk for severe COVID-19 and complications of COVID. So this can include sickle cell disease, diabetes, chronic lung diseases like emphysema or bronchitis, asthma, chronic kidney disease, heart disease, obesity. So when you look at conditions that disproportionately affect us, and then you bring in a virus that really kicks people while they're down,
Yeah.
it's a recipe for disaster. And when I talk about complications of COVID, I mean needing to be hospitalized, possibly in the intensive care unit, maybe on a ventilator, or even dying.
Yeah. We were taught, we were shared, people shared with us early on that if you had underlying or other challenges, health challenges, that COVID will affect you more aggressively, or there are other things that can, that you have a more likely, it's more likely that you'll be sicker, or
Mhm.
that you'll pass, or that that'll be more severe. And the health challenges that we already face as a community. Um, COVID didn't seem to do us any favors.
No.
So as we're looking at the statistics of why we are affected greater, a lot of them has a lot to do with the fact that we have more underlying conditions.
Mhm.
Um, True or no?
Yes, and this is actually not, we can't control all these things. The environment where someone grows up, the food they have access to is all, it plays into a lot of these medical comorbidities. So these are things that, genetically we may be predisposed to, but then if you cannot access the healthy food, then it's going to go a long way towards weight gain. So a lot of
Hmm.
these things are, we talk about like structural racism and things like that. And, though that stuff that's built into society sort of keeps us down when it comes to these health conditions. So it puts us at a disadvantage.
Gotcha. Um, there's this conversation happening around the community that COVID was on a Lysol bottle. It was on other disinfectants for years. We've known about it for years. Why is it so difficult to stop now? Can you kind of speak about what's the latest on this mutation?
hmm So, good question. There are a lot of different coronaviruses. So, when I learned about coronaviruses in medical school, I learned, okay, this is the common cold, just like rhinovirus is another virus that causes the common cold. But the problem with this one is that it got into an animal reservoir and they think it's bats and it
Okay.
mutated. So then it was super contagious and able to spread in ways that regular cold viruses do not. So regular cold viruses are usually spread by droplets, so like larger fluid-filled particles that come out of the sick person when they cough or they sneeze. But they're so big that they're heavy. They drop after they drop when they get farther than about 6 feet. So
Okay.
for normal cold viruses and influenza, you're looking at droplet spread. Plus, like if you touch something that is contaminated with the nasal or oral secretions of someone who's sick, and then you touch your eyes, your mouth, your nose, you can get infected that way. The problem with COVID is that it takes a lot less virus to get infected,
Hmm.
and there's this talk about the airborne spread, and so that is why they think that so many people were able to get infected so quickly, and why if you're in an enclosed room and there's someone who's sick and they're talking, breathing, singing, then it can spread that way. And there's also some evidence that the virus can linger in the room. So even after the sick person has left, if someone comes in a short enough amount of time, then they could potentially get infected. So the problems are that it's much more infectious because it's mutated, and then also just the devastating complications. We have not seen a virus just rip through the whole world and kill so many people. One thing I did want to touch on was, um, people ask, like, are people actually dying from COVID-19? Is this a
Right.
thing? And, you know, if you look at the Johns Hopkins website, they have data as recently as today, and they estimate the mortality rate of COVID-19 to be 1.8%. So if you calculate, like, okay, 32 million people have gotten COVID and 500,000 have died, 1.8% may seem low. However, when you think about 500,000 people dying,
Right.
that's a lot of people.
Yeah. Yeah. I was interested to know that those statistics that you just shared, like how many people have died, and how or been affected by COVID, and as a result of catching COVID, passed from another underlying disease. So I'm not sure if those two numbers are together, or we're talking something. Those are two separate.
It's a good question. So I have not seen data reported out where they separate out whether someone's cause of death was acutely from COVID, meaning like in the moment, the reason why they passed away was because they were infected with COVID-19 and unable to recover,
Right.
or if it was some sort of complication from COVID,
Right.
because with the way that death certificates are done, the doctor can list, what they think happened to the patient, and if they think that COVID was contributing, that may be on their death certificate, but it may not have been an acute case. So
Gotcha.
I'm sure that information is going to come out, because when you have 32 million people in one country infected, people want to know. I would be really
Yeah.
interested to know as well.
Yeah. Um, so just getting more into this to the virus, I mean to the vaccine. Can you give a little bit of context around how vaccines are created, what that process is like, and specifically the COVID vaccine, what that's how we've gotten to this place of having vaccines.
Sure. So typically, a vaccine product will take somewhere between like 9 and 12 years to get pushed all the way through. This is from initial testing in the lab, um, all the way through clinical trials with humans. And the reason why this vaccine process was consolidated and condensed, is because we were in the middle of a public health crisis, and really we had to try to protect people from getting severe disease and dying. So basically, what they did was they shortened the timeline for
Mm.
meeting all the milestones. They didn't cut out any steps. So the emergency use authorization is a special provision under the FDA for medications and vaccine products that are needed for public health emergencies. So if it had not been a public health emergency, we would not have had vaccines available. Um,
Gotcha.
so essentially, what happens is, so the technology actually that the mRNA vaccines, the Pfizer and the Moderna, are based on is actually pretty old. It predates COVID by probably over a year, because they were already looking into this type of vaccine for other conditions like Ebola. So it's not brand new, but they were able to adapt it for COVID-19. And the same thing with the viral vector vaccines like the AstraZeneca and the Johnson and Johnson. They were already in use for other conditions, and they just adapted them to fit for COVID-19. So
Gotcha.
what they basically do is they test the vaccine product in the lab, and once they have a product that they think is going to work, then they start clinical trials. And these are volunteers, young, healthy people who show up to get the vaccine, and then they're monitored very closely. And then that's phase one. And then they will go through um, phase two and phase three. So they're looking for the safety. They want to know about the adverse effects, the things that um, complications, side effects. So they're looking for that. And then finally, they're actually going to look at people who more so represent the general population, because not everybody's healthy. There are people who have chronic conditions like the ones I listed, lung diseases, heart disease, kidney disease, cancer, HIV. They recruit people who have all these chronic conditions to test the vaccine in them to see if it works and to see if it's safe. So there are a lot of steps involved in the whole clinical trial process before the vaccine ever makes it out to the public. So that's just sort of a quick overview.
Yeah, I think that's an important factor. I'm sure there's a sentiment that people don't want to be guinea pigs. We don't want to be the first wave of anything. Like that's a real feeling, and I think it probably has something to do with the Tuskegee experiment. Can you touch a little bit about historically how we have some mistrust that stems from that experiment, and how that really shouldn't be bled into or shouldn't be connected to this vaccine?
Sure. So the Tuskegee experiment was a truly horrific time in our country's history. It was a set of experiments that basically ran from the 1930s to the 1970s, in which African American men were told that they were being treated. And the real reason why the experiment was being done was to look at the natural history of syphilis. So, in fact,
Hmm.
these men were getting infected and they never got treatment. The
Wow.
study investigators wanted to see all the complications of syphilis and what can happen to people, and these men never got treated. And so, in the end, in the 1970s, when all of this was uncovered, the government ended up having to pay restitution to all the family, all the surviving, wives and children of these people. Um, it it was something that really changed the way that research is done, because now it is not legal to tell people that they're being treated for something, give them an infectious disease, and then allow them to just go off and potentially have complications. Um, what's really interesting about this whole vaccine process is that you know thousands of people, like 30 to 50,000 people, volunteered to be part of the clinical trials on
Hmm.
these vaccines before they got to any of us. So really, those people were the ones signing up to be, to have the experimental treatment first to see, what the effects were. And so then if tweaks had to be made, they were made before the vaccine got to the public. Um, that being said, millions of people have now gotten this vaccine, and there's actually a website called VAERS where you can actually scan a QR code when you get the vaccine, and you can report your side effects. They
Hmm.
want to know. This is not something where um, you know the idea is to keep quiet. Vaccine side effects, they want to know, like the government and the vaccine manufacturers want to know, because um, this is the only way that we can identify if something is going on. And so they take vaccine side effects really seriously.
Yeah, I was and I know that was one of the questions that I got the most, right? About I don't want to be the first one to take it. I'll wait until the second wave. And what does it really do, that sort of thing. So it's good to know that there were clinical trials. There were a lot of
Mhm.
people that they've tested and monitored, and and have results from, and from those results we've gotten improved vaccines based on results that have been tried. So that's good to know. um, does a vaccine stop is it a cure, and does it stop the spread of COVID?
Okay, so in terms of cure, no, the vaccine does not cure COVID-19. Actually, we should probably talk a little bit about how these vaccines work.
Okay.
So basically, the mRNA vaccines, which are Pfizer and Moderna, mRNA is a type of genetic material. So it's basically like a little roadmap. So what it does is when you get the vaccine, this genetic material is taken up by your cells, and your cells learn how to make antibodies, which are protective proteins that prevent um, the virus from making you sick. So the important thing to note about the genetic material is that it does not incorporate with your own genetic material. The
Hmm.
mRNA is actually so fragile that it has to be coated in a special fatty substance in order to even survive long enough for your body to create the antibodies. And that's the other reason why you may have heard about the Pfizer vaccine having to be stored in ultra low
Store it, right?
temperatures. Yeah, because it will degrade. And any of these vaccines that are on the market really have to be stored at controlled temperatures in order to avoid losing effectiveness. So the viral vector vaccines are a slightly different. That's the Johnson and Johnson or the AstraZeneca.
Mm-hmm.
Basically, what happens with these is that they take a harmless virus that does not cause disease in humans, and that's what's in the J&J and the AstraZeneca. So basically, that virus goes to your cells and again teaches your cells how to make protective antibodies. There's nothing from the genetic material of there's no COVID genetic material left in your body. And then this harmless virus in the adenovirus vector vaccines, it's not left there. There's no trace of it left. So um, that's something that I thought was really important, is that the vaccines are not changing who you are,
Right.
um, and they cannot alter your DNA. And then can you repeat the question just so I can make sure I go back to it?
Yeah. Does it stop the spread of COVID? How does it stop the
Yeah,
spread?
yeah. Um, so we talked about the why does it not cure you? So
Mm-hmm.
really, this vaccine is meant almost like a warning system for your body, so that the next time that you encounter COVID, their alarm bells are raised, and you say, "Oh, this is bad. I need to destroy this." So then your body can kick into gear and produce these antibodies and try to destroy the virus before it makes you sick. So that's the reason why it doesn't cure you, is because it's a preventative. It's to prevent you from getting ill from COVID, from getting sick with COVID. It is still possible to get infected with COVID despite being vaccinated, but just like with influenza, people who are vaccinated seem to have a less severe illness if they do get infected. And then you asked me about how it stops the spread. So basically, the way that the vaccine helps to stop the spread is that if fewer people get infected, then this virus has a harder time spreading. It needs humans as a reservoir. It needs people coughing, singing, um, talking, breathing in order to spread. And so if fewer people can actually get infected or get sick, then fewer people can pass this virus along to others. Now, I know that there's a lot of news reports out saying that the data is still coming in about whether the vaccines prevent transmission. But what we know is that if fewer people get sick, then there are fewer people out there to spread the virus in the first place.
Gotcha.
And the major benefit really of the vaccine is to prevent severe COVID-19 and death. So when I talked about those complications like hospitalization, being in the ICU, needing to be on a ventilator, those are the things that we're trying to prevent.
Gotcha. There was a question came in. A young lady asked um, if she should get the vaccine if she has cancer.
Good question. So the relationship of vaccines and cancer and other conditions that decrease people's immune system is basically that sometimes people who have weakened immune systems don't respond as strongly to the vaccine. So they may not get as much protection as somebody whose immune system is completely intact. Now, generally, what the CDC recommends is that if you have cancer and you know that you're going to be getting chemotherapy or some other treatment, like a bone marrow transplant or something that's going to really knock your immune system down further, that you try to get vaccinated about 2 weeks before that. And if it's not
Gotcha.
possible, then you can go ahead and get vaccinated when your oncologist says that it's okay. You wouldn't want to go get vaccinated potentially on the same day you're going to start your chemotherapy. So you'd want to work that out with your oncologist. But actually, the CDC is recommending that people with cancer go ahead and get vaccinated once they get the okay from their doctor.
Gotcha. Um, will this vaccination work? I know we talked about the virus mutating and growing and having different variations to it. How will this vaccination affect the future?
So good question. A lot of people have asked me, like, why would I get vaccinated now if there's mutants out there and maybe this won't protect me much? The catch is that we really need to vaccinate as many people as we can now to cut down on the spread. So if fewer people get infected with COVID, then the virus can't spread. And not every case of COVID is a mutant or a variant form. Um, just because you may have heard about some of the variants, like the UK variant or the Brazil variant,
Mm-hmm.
um, not not all of the circulating COVID is that strain. So even if one of the vaccines loses some efficacy against variants, you can't predict which variant you may get infected with. So it's still worth getting vaccinated now. And I'll tell you why. Because the vaccine manufacturers are actually working on boosters. There's been a lot of talk about, how often are we going to have to do this? And really, um, I've been hearing some reports that this looks like it's going to be a yearly thing. Um, that you would need to go in just like you get your flu shot and get your COVID vaccine, once a year potentially. We'll know a little bit more firmer information about how frequently the boosters would have to occur, but there's research ongoing now with people who volunteer to be part of clinical trials once again, um, on boosters that are specifically meant to address these variant strains. So it's worth getting vaccinated now to protect yourself now, because not all of the COVID circulating is a variant. And if you get a booster in 6 months to a year, then you're building on top of the immunity that you already have.
Gotcha. As you can read on the screen, that was my next question. We've heard about 2 shots and needing more shots later. How often? Your booster sounds a lot like me updating my iPhone,
Yeah.
and getting and having to update my iOS so that it can have the new functionality,
Mm-hmm.
and these new features. So thank you for that.
Mm-hmm.
Any there's a question. This gentleman says, is it encouraged to get the vaccine if you're rarely sick and very healthy?
That's also a really good question. This comes up a lot. I meet patients in the hospital who really don't have chronic illnesses. They may come in there with like a cut that got infected and they're otherwise young, healthy, no diabetes, no medical conditions. The reason why people who are healthy and don't typically get sick should get vaccinated is to cut down the spread. So you may have heard a term called herd immunity or community
Mm-hmm.
immunity. And what that means is that when the majority of the population uh, is immune to the virus, either from vaccination or natural infection, the virus can no longer spread. So that people
Gotcha.
who were unable to get vaccinated, like right now, the vaccine is not approved for children younger than 16. So if
Okay.
we were to achieve herd immunity, it would mean that all those kids who don't even have an opportunity to get vaccinated would still be protected. Um,
Gotcha.
it's all of our responsibility to try to cut down the spread. And there are ways that are not vaccines that help, like the masking and the social distancing and the hand washing. But in order to stamp out this virus, we really do need to make people immune to the virus. And we know that vaccine immunity is lasting at least 6 months. They have studies on the Pfizer vaccine showing that it's lasting at least 6 months. We don't know how long the immunity that you get naturally from infection lasts. So all the studies are ongoing, but really for the healthy people, the reason to get it would be to stop the spread, contribute to the herd immunity, and also decrease your chances of giving COVID potentially to someone in your life that may not be as healthy as you.
And then, Dr. K, would that also, getting the vaccine, would that reduce the chances of um, the mutation happening?
Yeah, that's a really good question. So yeah, if the virus cannot spread, then the amount of mutations that happen will decrease as well. So it's sort of like I thought about it as my contribution to um, this public health crisis, I said, okay, I'm going to get vaccinated because I want to protect myself from severe COVID-19, and I want to try to do what I can to cut down the spread.
Gotcha. Another question: Who do you recommend? What do you recommend to people with a history of blood clots?
Good question. So this question becomes very relevant because you may have heard about some of the blood clots associated with the viral vector vaccines. Those are the Johnson and Johnson or J&J and AstraZeneca. So the thing that I guess I would say is that you have a choice about the vaccine product that you're receiving, and you will get information when you go to the vaccine site to read. And so if you have a history of clots, then you may be more inclined to take a vaccine that's not one of the viral vector vaccines, because while clots are rare, they're a very rare complication. Like I'm talking 6 cases out of 6 million J&J vaccines given. If you do have a history of clots, then taking one of the mRNA vaccines, the Pfizer or the Moderna, may be a better choice for you. But what I would always recommend is that you actually have a conversation with your hematologist. If you have a history of blood clots, then you should have a hematologist or a primary care doctor, and I would say discuss with them. But if given a choice, there haven't been blood clots observed with the mRNA vaccines. So that may be the choice for you.
That perfectly kind of lines us up to kind of talk about the Johnson and Johnson situation, the pause. I think you gave the statistics on how few a number it was, but I'm sure we all heard it was the headlines for a while, and on some fronts, I think have even caused some people to not be vaccinated. Can you speak a little bit about the Johnson and Johnson situation?
Sure. So the reason why it was paused is because, like I said, basically anybody who's been vaccinated or healthcare providers caring for people who've been vaccinated can report vaccine side effects. So what the CDC noticed, the FDA and the CDC noticed, is that there was this run of 6 young women, all under the age of 50, who had these clots. There's something called cerebrovenous sinus thrombosis. And so it's a special type of blood clot in the brain. And along with the clots, they also saw that they had low platelets. And so there was this run of 6 women. And so they paused it because they needed more time to investigate whether, number one, is this a higher incidence or more people than normal. So this condition can occur in people who've never been vaccinated for COVID-19. It was known before these vaccines came on the market. So they needed to know, is this really higher than the usual incidence? Can we identify people in whom this vaccine might be higher risk? And is this unsafe? And so they took time to go back and look through all the cases and figure out what was going on. And then they met, and what they came up with is basically that people should be offered a choice when they go to the vaccine site, and they will be given information to read about the clots and side effects for whatever vaccine product is being offered. And so it was found that the incidence is not higher than normal. So the incidence normally is about 2 in 1 million. So if you think about this, 6 million people got this vaccine, 6 had clots, so that's 1 in 1 million. So it's actually not higher than the usual incidence. And they basically said that if you're a woman under 50, then you could consider choosing another vaccine product. It's not a mandate. It's not something where they say, young women must choose a different vaccine product. However, they want people to have all the information and be able to make an informed decision. So it is a very rare side effect. And like I said, this type of clot is much rarer than getting clots from COVID-19 because once you get COVID-19 disease, you're what we call hypercoagulable, meaning you can form clots anywhere. Had patients have strokes, blood clots in the legs, blood clots in the lungs. So the chances of clotting with COVID-19 disease itself are much higher than getting a clot from the J&J vaccine.
Thank you. Thank you for that, because I know that's been a sticking point, and also the effectiveness of one vaccine comparing to another. I know there's a percentage that is connected to the vaccines. Can you talk a little bit about what those percentages mean, and is there one better than the other, so on and so forth?
Okay, so the percentages that you may have seen were like 95% effective for Pfizer and Moderna, and something like 66.3% effective for the J&J vaccine. Now, the thing to know is that these vaccines were not compared head to head. So the clinical trials actually took place at different times of the year in different locations across the globe. And there were
Wow.
different sorts of variants circulating when each of these vaccines was tested. So you really can't compare all of those percentages. It's very tempting because most people will say, yeah, I want to go with the one that has the higher percentage. Like, why would I not want 95? But the thing
Right.
is, you can't compare them directly. So really, what the CDC says and what I agree with is that the right vaccine product is the one that's available to you, um, unless you have allergies to something that's contained in the vaccine. And they will give you a list when you go to the vaccine um, site. They can give you a list of the things that the vaccines contain. Most of it's like salts and sugars and buffers and the mRNA, messenger RNA, things like that. But there is something called polyethylene glycol, which is in the Pfizer and Moderna vaccines, and then polysorbate, which is in the J&J vaccine. So if you have a known allergy to those, then you would need to consult with your doctor before getting vaccinated.
Perfect, perfect. That's good to know, because I know that there's always an debate. We're not getting the best vaccine. Johnson and Johnson's only 70. This is 90. And we're as we build up all these conspiracy theories as to why another barrier of entry for us not to get the vaccine. So I really wanted you to speak to that, so that we can be comfortable to know that we're not getting a less product. I'm so thankful that Lauren is getting us Pfizer. So Pfizer is going to be available for us at the church, so that won't be a barrier of entry for us either. We have another question from, it's two similar questions actually. How long after getting COVID can I get the vaccine? And then there's, how soon should you get the vaccine after you've had the virus? And should you get the vaccine if you're still experiencing some side effects? So we'll kind of put those two together.
Yeah, so basically, you can go to get vaccinated for against COVID-19 as soon as you're out of your isolation. So typically, the isolation is 10 days from the onset of your symptoms. So when you started feeling ill with COVID-19, you're going to count that day and then 10 days out. So you would need to be out of isolation, number one. And then number two, you're going to want to be without fevers for at least 3 days with no fever reducing medication. Um, as long as you're feeling better and all of your symptoms are improving and you're out of your isolation period, then you could go to get vaccinated. There is one caveat that I want to mention. If you went to a healthcare facility and you got monoclonal antibodies, you've probably heard about the bamlanivimab, etesevimab. You may have heard about those uh, antibodies against COVID. If you got that, or if you got convalescent plasma treatment at a hospital, then you need to wait 90 days to be vaccinated, because those things can have lingering antibodies in your body for up to 90 days and can make the vaccine less effective. So really the only reason to wait an extended period of time is if someone has gotten monoclonal antibody treatment or gotten convalescent plasma.
And
And
you
then
have all this stuff just in your head.
Yeah, yeah. I mean,
Wow.
I this is my day to day. Um,
Wow.
I think she had another question. There was a second
Uh,
question.
Let me get back to it. And should you get the vaccine if you're still experiencing some of the side effects, some of the effects of the
Oh
virus?
yeah. So you can still be, a lot of people have the fatigue that lingers, a little bit of shortness of breath that lingers, sometimes the brain fog. Um, those sorts of things shouldn't stop you from going to get vaccinated. Now, if you're still coughing, hacking up a storm, and you can barely breathe, then you need to stay at home until you're a little bit more well. But once you're feeling able to get out of the house again, and it's been at least 10 days since your symptom onset, you go get vaccinated. The one thing I wanted to mention was about people who are asymptomatic. So that means someone who was tested positive, but they never had any symptoms. So the easy way to remember this is if you're asymptomatic, you can get vaccinated when you're more than 10 days after your positive test. So the magic number here is kind of 10 days for everything, as long as someone is recovering and doing better than they were when they were actually ill.
Okay. Are there any vaccines that are more effective or less effective for people of color?
No, I can confidently say that all of these vaccines were tested in a wide variety of people from different ethnicities, different races. The clinical trials, you know, include people of color as well. So there's no vaccine that's more effective for people of color. There's no vaccine that's more effective if you have a certain blood type. Um, none of that makes a difference.
Good. Awesome. Um, are there any known side effects, short term or long term? What are the numbers or the information tell us?
So the short-term side effects for this vaccine, Pfizer, Moderna, J&J, are pretty much very similar to a flu vaccine. You might get aching and pain in the arm where you had the shot. Some people get some generalized body aches. They may feel a little bit fatigued. Typically, these things go away within 2 days. Some of the side effects that are kind of unique to the COVID vaccines, some people will get some headaches. Um, I can actually tell you that after I got my second vaccine, I had headaches, I had body aches, I felt tired. I still went to work and did a call shift at the hospital, but you get through it. So the short-term side effects, they go away really quickly. Um, there's not data on the long-term effects. The thing is, we just haven't seen any reported.
Right.
So, as you know, with any vaccine, there are things that can happen. You may have heard about like Guillain-Barré, which is a nerve problem. Um, so, if you have a history of that, you want to talk to your doctor before getting vaccinated. But we haven't seen this vaccine causing higher rates of complications, like long-term complications, compared to other medical products.
Good. Um, and then we're almost wrapping up here. So again, thank you for literally sharing as much as you shared and making us feel at least more comfortable and someone to answer our questions, um, and really appreciate it. After we're fully vaccinated, can we stop wearing these masks? Like, what does that do to social distancing? Can we go back to normal?
Well, that's a good question. All your questions are so good. So, after you're fully vaccinated, the real advantage is that you can socialize unmasked with other people who are fully vaccinated. So let's take a step back. What is fully vaccinated? Fully vaccinated means you're at least 2 weeks after your final vaccine dose. Since you guys are having access to Pfizer, it would be 2 weeks after the second dose. If someone already got J&J or is going to get J&J, then it would be 2 weeks after that dose. So that's fully vaccinated. So the perks of getting vaccinated, besides avoiding death from COVID-19 and hospitalization, is that you are able to socialize with other people who have been vaccinated. Um, Now, in terms of taking off the masks, that stuff goes hand in hand with the case rate. How many people are still getting COVID-19? Is it still spreading? And for me personally, I won't be taking off my mask until I'm sure that the numbers are much lower than they are now. I still look at the LA County, they have some things on social media where they publish every day the number of cases, and they're still in like the 300 or 400 range. And there's still like a handful, at least a handful of people dying every day from COVID. So I feel more comfortable still wearing the mask. The CDC had released some things this week saying that people who have been fully vaccinated can walk around outside without a mask as long as they're not in a crowd. But I would say that it's never wrong to be more cautious. Um, you can only be less cautious. So the social distancing and hand hygiene and masks are still needed until we achieve that herd immunity we were talking about before. And we're really nowhere near that. We need hundreds of thousands of more people vaccinated in California to even approach herd immunity.
Gotcha.
And hand hygiene is needed all the time.
Yes, yes. Even when this is over, people still need to wash their hands because there's other stuff that they can get besides COVID.
Yeah.
Yeah, the one benefit that I've seen is that my kid hasn't gotten a common cold because we've been so conscious of washing our hands, and the mask have, at least that's kept the common cold away. So he was getting colds all the time, but I'm sure that's another story. These are not my questions. These are questions that people sent in, so I'm grateful for the people to share their questions. Okay, these are the last couple. We had a couple other comments, but the who would you recommend not be vaccinated? Are there people that you would say, hey, you should not be vaccinated?
So the only thing that comes to top of mind for me are people who have severe allergies to vaccine components. And these would be people who know that they're allergic to polyethylene glycol or polysorbate. Those are the people who should really speak with their doctor before getting vaccinated to find out if there's a vaccine product that's recommended for them. Because sometimes there may be a vaccine product that doesn't contain either of these. And so they're able to get vaccinated that way. There are some people who may have had complications from previous vaccines. Like I mentioned, people with Guillain-Barré, which is a nerve problem. If they are going to think about getting vaccinated, they should definitely discuss it with their doctor, because sometimes people can have a recurrent event if they had, a complication from a prior vaccine, and they would want to talk to their doctor. But there's nobody who I just off the top of my head say should not get vaccinated. I always think it's worth a conversation with your doctor before you just decide not to get vaccinated. It's worth the conversation.
One more question from the audience from the live stream before we go to the last question. Not sure if you answered this, but why is there 2 doses of one brand of vaccine and 1 dose for another?
Yes. So the reason why the mRNA vaccines have 2 doses instead of 1 is because that's the way that they were actually designed. So when they were testing them, they could really only get to about 50% efficacy at best, no matter how high they kind of made the dose in the 1 shot for the mRNA vaccine. So they realized, okay, we need to have this booster in order to get this high amount of vaccine efficacy. So those 2 vaccines were designed to have a booster because they noticed in the early testing that they just weren't effective enough. Now, with the J&J vaccine, it was designed to be 1 shot. That said, there is additional research going on about boosters for that vaccine as well. So it's really the way that they were designed in order to achieve the maximum amount of protection. That's why the mRNA vaccines are 2 shots instead of 1.
Okay. Are those I'm getting a different set of medicine, like some different. I guess second one's different than the first one. It's not 2 of the same ones.
Oh, no. So sorry. Actually, basically, it just takes 2 doses of the same in order to get your body to really recognize COVID-19 and create that strong immune response. It's it's almost like when you've met someone for the first time, you're like, okay, I've met this person, but then the next time you see them, they look familiar. So that's
Gotcha.
what's happening. You're seeing it, your body's seeing it again, and then it mounts that really strong immune response.
Gotcha. Okay, that explains it. Um, and then our last plea, kind of our last information. Um, if you had to do a closing argument and you had to tell people why they should be vaccinated, can you do that in your own words?
Sure. For me, I think that people should get vaccinated to protect themselves, to protect their loved ones, and to do their part to cut down on the spread of COVID-19. I'll give you an example. My grandma's 89. She's my mom's mom. She's stubborn. She was like, I don't want that vaccine. It contains plasma, which is really not true. So I had a talk with her and I said, no, it doesn't contain plasma. You're 89 years old and you do have health problems and we want you around. We don't want you to get COVID. We don't want you to end up in the hospital. So, really, in my mind, it's protecting you, yourself, your community, and trying to cut down the spread. I know that me getting my shots contributed to the herd immunity. It's going to take, hundreds of thousands of more people to get vaccinated and become protected from COVID in order for us to achieve herd immunity. And I know we're all ready to stamp out this virus and get back to our normal lives. And so I think if everybody takes the stance of, well, it's not my problem, I'll let everybody else get vaccinated. If everybody does that, or the majority of people do that, we'll never reach herd immunity.
Gotcha. Thank you. Thank you, Dr. K. Thank you, Lauren. Thank you, MLK, for making these resources available. And we're looking forward to May 2nd and making the Pfizer vaccine available for all those who are willing and able at the Bethel Missionary Baptist Church. Obviously, there's some restrictions, and you'll look online to see the flyer to make sure you fit those zip code restrictions, so that we can get the vaccine in the right hands. And I'm extremely appreciative for this time and for the resources and opportunity that you guys have provided.
Thank you so much. Dr. K, thank you so much. I appreciate it. And we're excited to be there on Sunday, this coming Sunday. We, as Pastor Stafford said, we will be providing Pfizer. We will have some J&J, but mostly Pfizer. So we're happy to provide this to the community.
Awesome. Thank you so much. Appreciate you guys, and I'll see you soon.
Thank
Thank
you.
you.
All right, bless you.
Bye bye.
Bye.